So do you need a breast lift, a breast implant, or both? That's a question that sounds simple, but it's not always that simple. A lot of times I get patients coming in asking for a breast lift, but what they do need is an implant, and vice versa. So what is a breast lift? A breast lift, also known as a mastopexy, is a procedure where we take the existing breast tissue, lift it, shape it, sculpt it so that it's not only in a better position, but provides better fullness on top and better projection, but again, using only the patient's own natural breast tissue. A breast augmentation obviously is putting an implant in to add volume and create the volume on top and the projection with the implant. Some patients need both because they have a combination of lack of volume, excess skin, and drooping. So those patients need a lift augmentation. Now, how do you know when a patient does need a lift? Well, one simple way is just calculating where the nipple position is. So if you look at the nipple or the nipple areola complex, it needs to be above the fold. So the fold is that crease that you have naturally under the breast. The nipple needs to be at the level of the fold or above the fold. And in those cases, you don't need a lift. If the nipple is well below the fold, then you need a lift. And you can't just do a breast augmentation because it would give you a deformity that's actually called a Snoopy dog deformity, where it looks like the breast is drooping off of the implant. Now, the confusion comes in where sometimes I'll get patients thinking they need an implant. So, for example, a patient might come in with drooping of the breast, but they have a lot of breast volume. They have a lot of their natural breast tissue. And they think that adding an implant is going to provide a lift. It won't. Basically, if you do that, all you're doing is adding more weight to the breast because the implants obviously have a certain weight to them. So if the patient already has a lot of their own breast tissue and you add an implant, all you're doing is adding more weight. And as a matter of fact, you may create the opposite of what you want. It's just going to bottom out. It's going to look very bottom heavy, very matronly. And those patients maybe just need a lift. They just need to reposition what they naturally have, their own breast tissue. Now, conversely, some patients who have a drooping of the breast, they may need an implant because they don't have enough volume. So the question is, how much natural breast tissue do you have? Where is your nipple relative to the fold? And how much volume do you need? So if you have enough natural breast tissue, a lift is all you need to reposition that breast tissue into a more natural position and shape. And if you don't have enough breast tissue, then that's where you need the augmentation or the implant to add that volume. And if the nipple is not in the right position, then that needs to be added as well. So a nipple repositioning with a mastopexy or a breast lift in addition to the implant. So in essence, in order to determine the right procedure for you, you have to have a detailed consultation where we're going to be looking at how much breast volume you have, how much loose skin there is, where is the nipple relative to the fold, and that's how we can determine which combination of procedures would suit you best, whether it's just a lift, just an augmentation, or a breast lift with an augmentation combined. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.